Hi, my name is Dawn. I'm a psychiatric mental health nurse practitioner. I work in an inpatient unit where we work with patients with addiction, with mental health issues, dual diagnosis addiction. And oftentimes people come to a place in their lives where they are finally willing to seek treatment. So I was wanting to go over some of the treatment modalities that we have, some of the different avenues that a person might take when they're treating their mental health issues. Now, certainly inpatient is definitely that one that certainly frightens people. Outpatient services are typically hard to find, but we can find the outpatient services. But when you have an acute situation where there's immediate issues and the patient could potentially be in danger, or you just get to the point where you just have to walk away from everything for a while and just do a reset. We like to think of our facility as more of a reset and more of a training academy, a new way to do life, to see life a little differently. It's a reset button, but it's also a way to take advantage of the brain plasticity and start to actually heal from some of the traumas that many of us have had in childhood that we never addressed, that were just sort of normal for our family. So we accepted them as normal. And then we get older and we realize that maybe those old ways are not serving us well anymore. So when a patient comes to us, they've typically been through different medications, different treatment modalities, and just haven't been able to find exactly what's going to help them. Or they've tried something that helped for a while, but then they find there's still something missing, or they've just gone back to some of the old habits again, especially when it comes to the addictions. So when a patient comes to us, we want to approach things a little differently, a lot differently, and we want to take advantage of the healing that the brain can actually do. I'm always amazed at how resilient the brain is. Brain plasticity, what we know about the brain now is we can actually rewire the brain. We can start to respond to the world differently. We can do things differently. Our energy says a lot about how we're handling things in the world. I often use the example, if you have two people and they're on their way to a meeting, it's the same meeting and they're both stuck in traffic. They're going to get to the meeting at the same time. One has decided he's going to listen to music, he's going to just relax. It is what it is, he's going to accept the situation. The other one is honking their horn, yelling, angry, infuriated. Both of those vehicles are going to arrive at the destination at the same time. However, this person is going to have a really bad day and probably influence those around them, and it's going to be a difficult day for everybody because they're starting it out so angry. They're both powerless over the situation. This person, however, has chosen to have a different energy, a different response to the situation. They're going to have a better day. Their body's going to be healthier. They're not going to cause inflammation in their body and even free radicals in the body because they're actually deciding to just accept what it is and move forward and have a calm spirit about it. So then this person winds up not only victimizing those around them when they get to work, but also their family members when they get home because their day started off horrible. And the reality is it may have been half hour of a bad day, but they're going to say it was just a horrible day because of that short period of time. We can learn how to respond to the world differently. We talk here at Indiana Center for Recovery about energy healing, about our vibrations, about how we approach situations. We talk about ages of trauma and childhood trauma and how sometimes when we're triggered, we can actually be acting out in an age of trauma. So those are just some of the ways that you would approach a trauma-based therapy for a patient. Now, one of the other things that we do is we do a genetic test when the patients come in the door. Most of the patients have been through multiple medications, different combinations of medications, so we want to find out what medication might be best for that patient. We do two different types of tests here. We do the Genome-Mind test. The Genome-Mind test it's a little bit more detailed of a test than the GeneSight test. The GeneSight test has been a great test for us here. We've used it quite a bit, and it has helped patients understand things a little more in depth about their unique genetic makeup and what medications might actually work for them. Genome test is more along the lines of what a practitioner might use when there's a very complicated situation with a patient and they're wanting to gather a little more in-depth data. It's not as easy to read for the patient, but both of the tests are just phenomenal tests, and it's such a breakthrough for us to be able to look at a patient, their genetic makeup, and say, okay, we're going to choose a medication that we know you're going to metabolize correctly. And it takes out the guesswork. When we have someone for 30 to 60 days and we're trying to create a new habit, a new lifestyle, and get them on the right medication, we want to do this right away. So that way we can pick the right medication for the patient and we can go in the right direction. And this is your genetic makeup. So this is good for the rest of your life. If there comes a time where you're going into a different season in your life and there needs to be changes, it was your genetic makeup that was used originally. So that it's updated with new medications and the patient then can move forward to make a good choice with their practitioner. I really encourage patients to get to know themselves. We want to fall in love with ourselves, and we want to start treating our bodies, our minds, our spirit, our heart, our spiritual journey. We want to start looking at this as just an amazing system. And the more we get to know this system, the healthier we become, the more we are able to give back to our family members, to give back to society, to give back to our neighbors, to give back to the earth. One of the really important things I think that people need to understand is that when you're healthier, I'm healthier. Your energy is affecting me. My energy is affecting you. If you're healthier, your children are healthier. Your community is healthier. We're making better choices. We're able to heal one another. So it is really important. It's important to us here at ICFR that patients are healthy. We have a program here where we hire our patients back once they've been in remission from their mental health issue for 6 months to a year, depending on the situation. And then they become that person who comes alongside someone and helps them out. So peer recovery coaches are a big piece of and community health workers is a big piece of our modality of treatment here. You can see I have a healing bowl, the energies, and again, back to that original example, our energy can be reset. We can reset ourselves. We can have tools to reset ourselves and make that part of our everyday lives. We also do biofeedback here, and we also do transcranial magnetic stimulation, as well as Spravato, which is S-ketamine. So those are just some of the modalities that we're trying to take advantage of that brain plasticity. We are trying to heal the brain. We're trying to teach the patient how to fall in love with their body, their mind, and be proactive. I know when I get ready to go into a certain season that's the anniversary of my late husband's passing, that I'm going to kind of struggle through that season. It's also the winter time. Going into fall and winter, I have seasonal affective disorder. So I'm going to make a few medication adjustments for myself just during that time, because I know in the summertime I'm going to feel better. Those are things we want to teach patients about. We want to teach you about your body, about your mind. We do music therapy here as well as art therapy. What we're doing is opening new pathways in the brain, and we're connecting left-right brain, so that way you can start to see the world a little differently, and we're taking advantage of every opportunity we have to create the new pathways and the new healing, taking advantage of that brain plasticity. We also have an arcade here, and we have ping pong. Sometimes the therapist will play ping pong with the patients, and that way what's happening is it's creating that left-right brain connection while you're having the conversation. There are just so many ways that we can heal, and that's the goal, right? We want to heal. We don't want to just go back into the same patterns of disease. We want to heal and live our best life. And I often tell the patients, do no harm to yourself or others and live your best life. Be the hero in your story. You've seen my videos about being an NPC and a non-playable character in our own story. It's time that we start stepping into our resilience that we've survived for so long and then begin to thrive. So there are going to be links to the different types of therapy that we have to offer here in the video. And we're going to also visit some of the pieces of equipment so that way you can get a better understanding of what I'm talking about. So thank you for listening, and we'll head over to the TMS machine. Thank you.